Welcome to our stroke prevention and education class. We're so glad that you're able to join us. This is such an important topic, and I have lots of great information to share, so I'd like to get started. And we'll get through some of the intricacies of getting started here. So if you don't know me, my name is Lynn Morales, and I'm a naturopath in the Dallas-Fort Worth area. And so basically that means that I like to look at the body from a holistic perspective and to work to identify the root cause of illnesses and imbalances. And my passion is a modality called BodyTalk. And you can learn more about that on our website by searching under services for BodyTalk. Our website is accesscompletewellness.com. And I'll mention that a few more times throughout the presentation. Just so you know, I am not here to diagnose, treat, or cure anything. I am not here giving medical advice. I am simply offering information that may make a difference for you or for others that you know. And I'd like you to sit back, relax, and enjoy what you have to learn here. It's a very important topic. So know this, the sources that were used to create this presentation are going to all be provided to you in a playback. So that's super important for you to know so that you aren't stressing out trying to write everything down. So there's an awful lot of resources, and so each and every one of them will be shared, and we'll be mentioning various ones throughout our class. So why don't we get started with the basics? And the basics are, what is a stroke? So a stroke happens when blood flow to an area of the brain is just cut off. So the blood carries oxygen to cells in the body. And when those cells aren't able to reach the brain cells begin to die. And so stroke is a medical emergency. And it's important to get treatment immediately, as soon as possible. Some treatments only work if they're actually given within the first 3 hours. So a delay in treatment can really increase the risk of permanent damage or death. So super important to act fast. So speaking of acting fast, I want you to pay attention to this acronym. I'll quiz you on it in a little bit. 911 emergency, you know that one. But let's talk through about act fast. There's actually, this stands for something. So there are 4 major signs of stroke that you want to be able to recognize. And so the F in fast is going to be the face is drooping, right? So you want to ask the person to smile. Maybe does one side droop versus not? The other one would be the A, that is arm weakness. So ask the person to raise both arms. Does one arm drift downward? That's important to know. Then there's the S, as in Sam, speech difficulty. S is in speech. So ask the person to repeat a simple sentence. Are their words slurred? And the T in act fast is time to call for help. If the person shows any of these signs of the first 3, right, 911 or your local emergency hotline is the place to go for that. Now, there actually are more symptoms. So the FAST test that we just went over covers the most common symptoms of stroke. But other sudden symptoms that someone is having a stroke might feel like or look like this. One could be numbness or weakness in the face, the arm, or the leg, especially on one side of the body. They might have confusion or trouble understanding other people. They may have difficulty speaking, maybe trouble seeing with one or even both eyes, problems walking or staying balanced or coordinated, dizziness, even severe headaches that come on rather seemingly for no reason. So these are some other symptoms that you want to be aware of. Now, calling a doctor or driving to the hospital yourself, hear me, wastes time. That's right. Don't call the doctor. Don't go to the hospital driving yourself there, driving someone there. That wastes time. Ambulance workers, emergency medical technicians, these are the people. They can judge the situation a lot faster than you, and that boosts the chance of getting the potentially life-saving treatment that you might need. So if you have or notice any of the symptoms that we've discussed so far, call for an ambulance. Even if you're not sure, it's better to always be safe than sorry. So there's 3 types of stroke. So the first one we're going to discuss is the ischemic stroke. It's also known as a stroke caused by a blood clot, which accounts for about 87% of all strokes. That's right. So an ischemic stroke occurs when fatty deposits lining the walls of the blood vessels start to obstruct the blood flow. So there are 2 types of obstruction that can occur. Let's talk about what those are. So one type is called cerebral thrombosis. So this occurs when a blood clot forms in the brain's venous sinuses, and it prevents blood from draining out of the brain. Now, what's the venous sinuses? I'm glad you asked. That's the channel between the veins in the brain. So as a result, blood cells can break and actually leak into brain tissue, forming a hemorrhage. So this type of stroke can happen in people of all ages. It doesn't decide only a certain age, it's all ages, including children and even newborns. So the second cause of obstruction is referred to as cerebral embolism. So this is a blood clot that forms at another location in the circulatory system, usually the heart, large arteries of the upper chest and neck. And stroke occurs when part of the blood clot breaks loose. So you see this blood clot here in this picture, it's kind of moving a little bit clotty there. And so it enters the bloodstream then, and it travels through the brain's blood vessels. They're too small to let it pass. So a leading cause of embolism is actually an irregular heartbeat. And that can cause clots to form in the heart, dislodge, and travel up to the brain. So hemorrhagic stroke, these actually account for about 13% of stroke cases. And they're caused by weakened vessels that rupture and then bleed in the surrounding brain. And that accumulates and compresses the surrounding brain tissue. So the 2 types of weakened blood vessels usually cause hemorrhagic stroke. One is aneurysms, you've probably heard of that. And another one is referred to as arteriovenous malformations, or AV as in Victor, M as in Mary. So, but the most common cause of a hemorrhagic stroke is actually uncontrolled high blood pressure. So if you missed it, we did do a blood pressure webinar class just a couple of months ago. It should be out on our website, accesscompletewellness.com. And that would be a great way to get some information on how to bring that blood pressure down. Now, let's go back to the aneurysm. So that's a weak area in a blood vessel that usually enlarges. It's often described as a ballooning of that blood vessel. So they expand slowly and then they become weaker as they grow, just like a balloon. And then it becomes weaker when you stretch that balloon, right? Think of a water balloon. So people usually aren't born with an aneurysm. They can form from blood vessel disorders, infections, drugs like amphetamines and cocaine, or even direct brain trauma from an accident. So if an aneurysm forms, you know, there's about a 20% chance that at least one other is going to form. Isn't that something? So small aneurysms don't have any symptoms. That's right, no symptoms at all. But as it gets bigger, as it enlarges, it can produce headaches and even localized pain. So as that expands, it can create pressure on a healthy brain tissue and even adjacent nerves. Now let's get to that AVM thing I talked about. See, now you can see it in print there, arteriovenous malformations, AVM. So typically arteries carry blood containing oxygen from the heart to the brain. And so while veins carry blood with less oxygen away from the brain and back to the heart. So when an arteriovenous malformation occurs, it's like a tangle of blood vessels in the brain bypasses healthy brain tissue, and it directly diverts blood from the arteries to the veins. So brain AVMs, they occur in less than 1% of the general population, and they're more common in males than in females. So usually someone is born with an AVM. They're not generally inherited that they know of, inherited from your parents, and they likely won't be passed on to children. So that's important to know if you've ever suffered with something like that. Now, as the heart beats, it pumps blood around the body through a network of vessels called arteries so that muscles can get the energy and the oxygen that they need. So I'm going to explain high blood pressure to you. Now, this is going to be a shortened version of it because you got it at our website, accesscompletewellness.com. We already did a class on high blood pressure that goes into much, much, much more detail. So just want to make sure that you know that you're going to get just a little bit today, and you can get a whole lot more when you go check out that webinar. So as the blood vessels travel through the arteries, it pushes against the sides of the blood vessel. And so the strength of this pushing is called blood pressure. Now you know where the name comes from. So as your heart squeezes and pushes your blood through your arteries, your blood pressure goes up. And as your heart relaxes, your blood pressure goes down. So with each heartbeat, your blood pressure will rise to a maximum and fall to a minimum. So this duo of numbers is how your doctor explains it to you at the doctor's office. So that's your 120/80. Got it? That's how it works. So high blood pressure can significantly increase that risk of a hemorrhagic stroke because it means that your heart is under super stress and working harder to transport the blood. So I wonder if you can guess which gender might be more at risk of high blood pressure. So you can put that in the chat if you choose. I'm going to give you the answer now, though. It's men. Yes, men. Also, more at risk are the elderly, people who smoke, and people who drink alcohol. So you couple all that together with high blood pressure, and it creates a higher risk health-wise. Now here's a neat little acronym, TIAs. So transient ischemic attack. So they're also known as mini strokes. Now this is a major warning when you have a TIA that your body isn't functioning right and it's about to have a full-blown stroke. Did you hear that? If you have been told that you have these, you're very likely to have a full-blown stroke. So that's important for you to know. So TIAs occur from a temporary blockage of blood flow to the brain. And so what happens is the body, it fights back quickly by pushing the TIA back downstream, so to speak, or by using natural clot dissolvers. Did you hear that? Natural clot dissolvers. See, the body is really smart. It can do some things on its own, doesn't always need certain medications. So the important thing to know is that the blockage isn't in place long enough to do damage. That's the big deal, okay? So let me tell you some stats about TIAs because you might find these fascinating. So did you know a TIA happens before about 15% of all strokes? So TIA is like definitely a precursor to let you know what the big one's coming, right? And then up to 25% of people who suffer a TIA die within 1 year. Wow. So if you just thought TIAs, oh, it's just a little stroke, these are big stats. Little stroke, big stats. About 1/3 of people who have a TIA go on to have a more severe stroke within a year. So very, very important for you to know that. So anybody can have a TIA, but the risk increases with age. So if you previously had a stroke, pay really close attention to the warning signs that we talked about earlier. Remember I told you that acronym, think FAST, F-A-S-T. Go ahead, if you can recall what the F-A-S-T was, feel free to put it in the chat. Be fine with that. Let's see how well you know what you learned. Remember, you're going to get the notes later. I'm about to tell you again though. So the F, everybody remember the F? That was face drooping. F for face, drooping. A, arm weakness. S was speech difficulty. And T was time to call for help. That's right. Very good. Fast. Very, 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 very good. Okay, let's move on. So next is gender in stroke. So go ahead, you can put in the chat, who do you think, now you already answered men for something. Who do you think, I was trying to give you a hint, who do you think is at the greatest risk of stroke? Which gender, male or female? You can put that in the chat as well. And so if you said women, you were correct. So actually 1 in 5 women, 1 in 5, that's really scary numbers, in the US will have a stroke in their lifetime. Wow. So if like you're like a sister and there's 5 of you, 1 of you, that's pretty scary. And so just so you know, stroke kills twice as many women as breast cancer. So everybody makes a big, a lot of thing about breast cancer, but stroke kills twice as many women as that disease. So it's actually the 4th leading cause of death for women. That's important to pay attention to. So stroke kills about the same number of men each year as prostate cancer and Alzheimer's disease combined. Now, I know these stats may come as a shock to a lot of people, but there's really good news. And I try to mention this every time I have to mention strokes. The good news is that 80% of strokes are preventable. 80%. So we're going to get to that in a few minutes. Pay real close attention though, 80%. So let's talk about what puts some women at risk more than others. So one of them is high blood pressure. So 1 in 3 women have high blood pressure, and only about half have it under control. What about that, huh? Now, certain types of birth control medication can also play a role. Very interesting, don't you think? Now, I'm going to add one more. I have a special picture that I like to add because most people have never heard of this. Beauty parlor stroke syndrome. Now, I want you to pay attention to this lady. Now, remember, picture you're at the beauty parlor and your neck is hyperextended right into that sink. You see that sink? Okay. Now, this is not new news, by the way. This has been around for probably a couple decades, this information. And, a lot of women go to the beauty parlor. In fact, I am fairly confident. Now, I had a journey that I dealt with my mom with. She ended up with vascular dementia from a stroke. Okay. Now, I think she had some of those little TIAs. I think she had one of these, beauty parlor stroke syndrome. Mom would go to the beauty parlor twice a week. Now, you may not know this, but beauty parlors, they actually have a little pad that they can put right in that little groove there of the sink. It's a special groove, a special pad just for that groove. And they could also just put a towel there. Now, the thing is, the angle that your neck is in while they're washing your hair in the sink can actually sever an artery. And it might not be detected for 2 or more weeks. This is why I'm still convinced this is what happened to my mom. She ended up one day, it seemed like she was having a stroke. I believe it was a TIA. And I took her to the ER and they said, no, she did not have a stroke today, but she did have one a year ago. We can see it on the, the radiographs that they do, right? So interestingly enough, it was probably true, but I got to tell you, the conclusion of the study that was looking into this, they said that the hazard of sustained hyperextension and rotation of vertebral artery flow has not been previously addressed in the elderly population. I know this lady's young looking, but elderly population. And it says that they're disproportionately at risk for cerebrovascular disease. The following cases that they looked at suggested that every adult should be made aware of the potential dangers of extreme and sustained neck posture during activities of daily living. Do you know? So let me give you another example. How could this affect? Think about a house painter, and the painter has to paint the ceiling, and his neck is looking up for how many hours painting the ceiling, right? That's another example of this hyperextension. So interesting stuff here. Just I'm going to share with you how I think, we can help you move through this though. So again, let's move on to some more risk. So African Americans are more likely to have a stroke than any other group in the United States, any other group of women. And they're also more likely to have strokes at a younger age. Interesting, isn't it? Now they think it's part of the fact that African Americans tend to be diagnosed with higher rates of blood pressure, high blood pressure, obesity, and diabetes. Now, we have done classes on, like I said, high blood pressure already. Got a few things on diet. We're going to be doing one on diabetes in the near future. But African Americans tend to be more sensitive also to salt. And too much sodium can lead to high blood pressure. And then lastly, sickle cell disease. It's a common genetic disorder in African Americans, and it can lead to stroke. So compared to non-Hispanic whites, Hispanics have strokes at younger ages, while the average age of a stroke among non-Hispanic whites is 80 years old. Among Hispanics living in the United States, it's 67. That should speak to us. You should watch some of the other classes where we've talked about this. So the scientists don't know exactly why certain ethnic groups are at higher risk, but they believe it's lifestyle. I'm positive it's lifestyle. I'm not quite a scientist. I do like science, but I wouldn't put myself in that research category. But there are lifestyle and social factors that are going to definitely play a role. So prevention, this is super important. So what do we do? Now we've stated the problem, but how do we help address it? So high blood pressure can double and even quadruple your stroke risk if it's not controlled. And it's the most significant contributing factor to that risk in both men and women. So I already mentioned we did a blood pressure class already. You should go check it out. We gave a lot of great information in there. So just to cover a little bit though, your ideal blood pressure goal should be less than 135/85. For some, slightly higher goal may be more appropriate. And to reduce blood pressure, let's talk about a few things. Reduce your salt intake, maybe no more than half a teaspoon a day. Keep in mind, a lot of foods that you're probably eating that are processed have a lot of salt in them. Avoid high cholesterol foods, red meats, fried foods, ice cream, things like that. But keep this in mind. We also did a class on cholesterol. So accesscompletewellness.com, you can go learn about cholesterol and some of the great suggestions that we gave around diet there, because nobody wants to keep being told to stop eating all these things. And that's really, you know, you don't really have to stop eating so many certain things. Some of the stuff really isn't that bad for you in moderation. Now, you also want to eat 4 to 5 cups of fruits and vegetables every day, a serving of fish 2 to 3 times a week. And like I said, go check out our blood pressure webinar. But I'm going to let you know in a moment, most people aren't eating enough fish. I don't know about you. I have it once a week, and but I'm going to tell you what I do to get my levels where they need to be. Now, everything goes back to weight loss, doesn't it? So obesity, as well as that complications linked to high blood pressure and diabetes, raises your odds of having a stroke. So if you're overweight, losing as little as 10 pounds can have a real impact on that risk of stroke. So what you want to do is you want to know your BMI, your body mass index. And we can help you learn that, what that is. In fact, we have a special program called Transformations, and we do a whole body composition analysis. And so we'll come up with a whole personal weight loss strategy plan for you as well, to make sure you're in range. You'd be surprised at how quickly we can get you where you need to be with the right information. So again, accesscompletewellness.com. On the bottom of our homepage, very, very, very bottom, you'll see something called Transformations, and it's an extensive program, all kinds of angles for health. Many things you have probably not heard of, but are still very effective. Now, of course, where would we go without physical activity? Now, this guy, he's looking like he's about to have something happen to him in this picture. Exercise, though, contributes to weight loss, so that's good. That takes care of the prior slide. Helps lower blood pressure. Oh, that's the slide before that, so this is all good. Exercise is good, and we're getting a lot of that lately, aren't we? It can also, though, as a standalone, be a stroke reducer. Nice, very nice. Wouldn't it be nice if maybe we could still eat some fun stuff because we decided to exercise and have some physical activity? And, you know, physical activity doesn't have to be like yucky on a treadmill. That's could sound yucky. It could be fun. It could be racquetball or tennis or, you know, like fun, running, volleyball, something. So anyway, so here's some ways to get some extra movement. Walking around your neighborhood. If you have a dog, guess what? The dog needs exercise too. Take the dog with you. You can even have an app that helps you, you know, score points and track you and, you know, do all kinds of stuff. It really does give you a boost when it's there encouraging you, going, hey, you did great. You walked today. You can exercise with your friends, take a class with them maybe. Now, some of those classes are a little hard to find right now, but there's a lot of online classes, that's for sure. You can take the stairs instead of the elevator next time you're going somewhere. Maybe park a little further from the entrance at the store that you're shopping at. These are just a couple little ideas to keep in mind. And you know, when you do exercise, reach a level where you're breathing hard, but you can still talk, right? I guess, you know, like you don't want to be so out of breath that you can't get words out, especially if something's starting to be wrong and you got to tell somebody and you can't talk. That's not a good thing, right? So exercise, reach a level where you're breathing hard, but you can still talk. So kind of do this. Aim to exercise about 30 minutes a day. And if you can't do a whole 30 consecutively, guess what you could do? You could break it up into 10 or 15-minute sessions throughout the day. Because guess what? Your cells don't wear a watch. Like, they don't know. So the point is, do a little bit as you can throughout the day. Just don't add more stress to the picture. Okay? Now, let's talk about this. Boy, not having this in your world is a great thing. So atrial fibrillation, maybe you're not familiar with that term. Some people call it AFib. And, you know, this is something my mom did have going on, and it's a form of an irregular heartbeat. And what it does is it causes clots to form in the heart, which can't, then what they can do is then they can travel to the brain and produce an actual stroke. Okay. So So those who have atrial fibrillation are almost 5 times more likely to suffer a stroke. So treatment does need to be taken seriously. But I'm going to share something with you, and you're not going to hear this from everybody. But you know, there are certain vitamin and mineral imbalances that can cause your heart to also have irregular rhythms. Okay, so keep that in mind. Maybe sometimes you could even eat a food that maybe you have an intolerance to or an allergy to, and you ever have a little fast heartbeat, rapid heartbeat all of a sudden, right? So lots of things can affect in that body chemistry. So I just want to share that with you. So sometimes some of this stuff can be corrected in that manner, corrected with proper nutrition. Okay, so again, on this prevention route, well, it'd be nice to prevent diabetes, right? So having, you know, high blood sugar damages the blood vessels over time. And maybe you didn't know that. But what happens is it makes clots more likely to form inside them. So if you do have diabetes, you want to keep that under control by monitoring your blood sugar, as your doctor might direct you. There's a lot of ways to do that. You can do that with diet. We highly promote that in our Transformations program, 5-week program. I have watched some folks who were diabetic have to call their doctor a couple weeks into our program and say, my blood sugar got a lot lower than it was. Can you lower my meds? How nice is that? So know this. So diet, exercise, great ways to get your blood sugar down. We actually even offer some herbs. There's some herbs that can help do that. And while they're helping control blood sugar, at the same time, they work on cravings for sugar and carbohydrates and things like that. So how nice is that, right? So additionally, know your risk if you think you're pre-diabetic. So 1 out of 3 people have pre-diabetes. About 90% of them don't even know it. Okay, so this is important. If you get blood work through your work, and then they say, oh, great, you know, and you're like 1 point, like you're the highest on the normal range, the highest number on the normal range, know this, 1 more point and you're a diabetic. Okay, so just being the highest number on the normal range isn't necessarily a good thing, especially if you're trending up. Okay, so if you're trending up, you need to be calling us. And it doesn't matter where you are in the country, we can work with you long distance on these programs. So very quickly, we can get those numbers down if you follow our recommendations. And we're talking about type 2 diabetes, by the way. So an easy way to know your diabetes situation, right, is this blood work. And we're going to send this to you. We have a very extensive questionnaire we're going to send your way. Specifically, it was designed to look at helping people that were pre-diabetic move in the other direction, in a more healthy direction. And we're going to offer that to you for free. Yes, for free. It will be in our resources that we send out after the webinar. But if you want to get a head start, go ahead. Here's what you do. You go to our website and you go to the website called Take WICO, W-I-C-O, like your FICO, but it's your WICO, your wellness index, not your financial index for credit reporting. So take, T-A-K-E, WICO, W-I-C-O.com. And they're going to ask for an access code. Your code is ACW, capital ACW, stands for Access Complete Wellness. Or you can just go to our website, lower left corner of the homepage, accesscompletewellness.com. It's going to be down there under that transformations program. You're going to see that WICO. You can click on it and go right in and take it. It'll give you all the same information. It can take about 15, 20 minutes to do it. You don't want to start it, walk away and come back. That's a bad idea. What you want to do though is as soon as you do it, this is your responsibility. You call our office, and I'll give you that number. You can reach us through the website, info@accesscompletewellness.com, as well as that's our email. We're going to give you the number at the end. But what you can do is you can reach out to us, schedule a free 15-minute consult. So this is a $75 value that we're offering right now. You're going to get this consultation where we're going to go over this great way to figure out how your blood sugar is looking, along with a whole bunch of other measures. All right, we're getting close to wrapping this up here. Another prevention: quit smoking if you smoke. So, you know, smoking cigarettes accelerates that clot formation. Maybe you didn't know that, because what it does is it's thickening your blood. So, and it's increasing the amount of plaque buildup in the arteries. So quitting your smoking habit is a really powerful lifestyle change that will help you reduce your risk of stroke. So don't be afraid to ask for help. You know, what worked for your friend may not work for you. So find someone that can help you, and someone who can, you know, help you in the most appropriate way. You know, you need to know this. Most smokers need several attempts before quitting for good. You know, view each attempt as bringing you one step closer to successfully beating the habit. You know, don't beat yourself up about it, please. But let me tell you what else we're going to offer. Now, this can be offered to everybody, but I want the smokers to hear this. This is important. We're going to send you access to a program that can help with overall wellness, from sleep to healthy eating to stress to anxiety to calming, things like that. We're going to give you free access, and we'll send you this link, and I'll outline it in the notes when we send it to you. Get a 15-day free trial. If you decide you like this program, and what it is it's some guided meditations, but it's doing it in a very special way, working on the body's acupuncture points. That's powerful, super powerful help. But attached to this is going to be an opportunity. There's a smoking cessation program that you can add on. So if you really want to try something very innovative, you can try working with this program. We'll send it out to you, and it'll come as a link in the links for the webinar. All right, so let me tell you some more. So I've got this before and after thing here I want to talk to you about, okay? So this is important. What else can you do for prevention? What I'm about to show you is a video. And this is something you want to do before. Now, if you've had a stroke, it's okay. This is still helpful to do. But some people have had debilitating strokes, and it's not good. I mean, they're beyond where things will repair like you'd hope. Okay, but I'm going to share with you this video. We offer this in our office. There is absolutely no reason, if you think you're at risk for a stroke, you want to pay attention to this video. So let me let them tell you the story of how we help you identify key markers, evidence-based research, to make sure that you're in a good space, that you're getting all the right nutrients so that your blood is flowing the way it needs to.
Optimizing the health of the brain is the future of healthcare. Brain health is the gateway to produce optimal health for the entire body. The ability to measure, track, and improve brain function and key blood biomarkers has profound implications for your overall health. BrainSpan is revolutionizing preventive brain health by providing a complete blood profile that reflects both cellular health and systemic inflammation and connects these metrics to brain function. The assessment provides vital data and education as part of a routine wellness visit for the student, athlete, mom, or business professional, or can be used to assist with the management and prevention of many specific conditions, including those of the nervous, circulatory, musculoskeletal, or immune systems. Fundamentally, all chronic disease will benefit from first optimizing the metrics critical to brain-body health. In addition, mothers and infants will reap dramatic health benefits throughout pregnancy and breastfeeding due to enhanced fetal brain development and improved maternal health. With the BrainSpan Neural Health Assessment, you will receive a detailed nutritional profile that determines cellular and inflammatory health of the brain and body, and links these areas to specific aspects of cognitive function. Valid, precise, and actionable are the hallmarks of the BrainSpan report. The Neural Health Assessment is simple yet thorough. It is generated from 2 brief steps activated from a small kit. 1. A patient-performed finger stick, providing a few droplets of blood on a card. And 2. A brief web-based cognitive function assessment on a touchscreen device. Within 2 to 3 days of processing, an electronic report is available that elegantly illustrates the status and relationships between nutrition, inflammation, and brain function. Specific information on the omega-3 index and the omega-6 omega-3 ratio, among other indices, help you avoid being in the dark when it comes to quality and quantity of specific dietary nutrients. The results of the cognitive function assessment are described to include the areas of attention, processing speed, and memory, linking them back to the nutritional metrics and specific lifestyle recommendations, making them more meaningful and motivating. A wellness summary is also provided so you can easily understand what your results really mean for you today and for your future if you don't take steps to improve it. Testing occurs at baseline, 3 months, 6 months, and then annually, ensuring the scores move and remain in the green or optimal zone. This represents the highest level of both nervous system and cellular nutritional health, providing lower levels of inflammation and improved resilience to chronic diseases, pain, and injury. Scores in the red or poor zone are associated with poor function, a high inflammatory state with possible increased risk of future diseases and premature cognitive decline. Tracking and keeping scores in the green year to year, you will improve total mind-body health and actually change the trajectory of cognitive decline over time, promoting a healthy, resilient life across your entire brain span. And this translates to an overall healthier lifespan. Lowering total body inflammation and optimizing brain function is essential for optimal health. And now, with clinically valid metrics from BrainSpan, this can be achieved with precision. BrainSpan. Measure, track, optimize.
Outstanding. So that is available. We will provide that link to you if you want to learn a little bit more, read a little bit more online. Now, we talked about the before and after, right? I just said before, gosh, if you haven't had a stroke yet, you think you're at risk, you definitely want to do the BrainSpan. If you have had a stroke and you're doing well, but concerned about the future, you definitely want to do a BrainSpan so we can make sure we get things in the proper levels. I'm going to tell you about something else. This thing I'm going to talk to you about right now, BodyTalk Access, there's a technique we teach in this class. We're going to give you that for free in your resources. It's called the Cortices technique. And what it does is it balances out the left and right brain. Okay, now this is important. It's important to learn it before something happens. Okay, because after a stroke is not a good time to learn this. But it will be very helpful applied to a person after a stroke. So what I'm saying is invite your families to learn about this Cortices technique. And let me tell you a little bit more about that. And this is huge. So I want to share this with you. This is this class that I teach. We now teach it online. We're so excited to do that. We're going to teach it again on June 13th. We're going to give you more information on it. So it doesn't matter where you are across the country. We can teach this to you. It will be a full day class. We're going to talk about it. But listen to this. So this is a person who, well, let me just read it to you. She says, I finished my first BodyTalk class and wanted more proof that BodyTalk works. I had read about the German nurse whose coma patients had regained consciousness after receiving Cortices. That's the Cortices technique. So I decided to do the technique on the coma patients I see in the ICU at the hospital where I work as an occupational therapist. Over the next 7 months, I did Cortices on 10 coma patients, and 9 of them regained consciousness that same day or the next. Now you guys are going, but wait, Why are you talking about comas? Because this is important. This balances the brain. This technique I'm going to give you guys for free balances the brain in such a way that it took 9 out of 10 people out of a coma. This is huge. So this person goes on to say, Marcy goes on to say, the results have been so amazing that I continue to do cortices on neuro patients such as stroke, head injury, and coma victims. I have observed that if cortices is done on patients as soon as possible, they recover more quickly and require less rehabilitation. I have seen severe stroke patients regain function. And in many cases, I am convinced that without cortices, they would have been going to a nursing home instead of back home to their families. So she did this after the fact. Okay, so that means you want to learn this. You could do this now, start balancing your brain, a lot of other great effects of it. But then you want family members, if you're at risk of stroke, to know how to do this so that they can help you in the event that something does happen. So I think this is outstanding testimonials. I wanted to share that. Now, this BodyTalk Access class I'm going to tell you about is on June 13th. Now, again, I'm going to give you the Cortices technique. So you can very easily say, well, gosh, why do I need to attend a class? Well, here's why. Because the founder who wrote this class, this is not a wellness class like you have ever taken before. Trust me on this. He said, my goal is in BodyTalk Access is to make these simple tools available to individuals so they can use them to help maintain the health of their families and communities. Okay, so let me tell you a little bit more about this class. You see the cortices there? You see the brain balancing on that high wire? Yeah. So this is about resetting your brain to improve overall communication between left and right brain. Okay, and that's the one I'm going to give you. Improving, focus and memory, releasing tension, improving sleep. So who doesn't need that? And then the next technique that we're going to teach you in this all-day class is called switching. And that's where we help you reset your stress threshold to help keep you calm and stop living in that fight or flight mode. A lot of stress has been around lately, and I know people could use some things to just calm down a little bit right now. All right, so this is going to help with improved decision-making, mood swings, and mental confusion. Then we're going to do teach you a technique on hydration. So this isn't about, hey, drink all these glasses of water. That's not what we're teaching you. It's nothing about that. It's about how do we help the body utilize whatever amount of water you decide to give it, because I know none of you are drinking enough water. Okay, body weight divided by 2 in ounces a day is what you should be drinking. Right? So you could put it in the chat if you want to fess up that you're probably not drinking enough. This is actually saying to your body, I'm going to use exactly what you give me the most efficient way possible. That's a very cool thing. Now, look at this neat picture down the bottom left, body chemistry. Doesn't that look familiar and yet creepy all at the same time? Because everybody now knows they have an immune system. And if you missed it, we did a class a few weeks ago, the role of immunity. That, I believe, is posted on our website. Go to accesscompletewellness.com, search on immunity, and it should come up, okay? What we're going to teach you in this class is invaluable, especially for such a time as this. We're going to actually give you a tool that you can do without supplements, without any other tools, no first aid kit required or anything like that. We're going to give you some tools to actually help your body address better viruses, bacteria, parasites in advance of getting any of them, and also to help assist if you do get any of them. So invaluable. It also has an allergy and food intolerance and a toxin component to it. Invaluable. We teach this to kids. So if you think this is over your head, no, it's not over your head. Reciprocals, we're going to teach you how to align your body from head to toe. Almost like a chiropractor. It's not like a chiropractor, but it does some amazing stuff to improve range of motion. And then an invaluable fast aid technique. What do you do in the event that you're out for the holiday weekend coming up and you go for a walk and you sprain your ankle because you walk in a little hole in the field? This is an invaluable tool that you'll learn and be able to use on the spot. So let me tell you a little bit more about it. Overall body support for this stroke scenario, if one should happen, we've got a great tool to help improve healing, something for immunity, something for posture, etc. So it's our BodyTalk Access interactive webinar. It is an 8-hour class, June 13th. You will not be bored, trust me. You are going to get so much value out of this. 6 techniques empowering you to bring about a significant improvement in your health. You're going to get a 38-page full color manual, absolutely beautiful. You're going to get a certificate of completion as a BodyTalk Access technician. You'll also be qualified and proficient to perform these techniques on family and friends. So super, super important. I want to read this testimonial. This one just came out of the class that we just did. I'm so excited about this. This wonderful lady talked about, you know, because that was our first online one. And so, you know, we were able to, I stayed patient with everybody. This is a good thing. Encouraging, especially when we ask questions. She goes over the information several times so that it sinks in deep. One of my favorite things she had us do was practice the techniques again and again. Each time she taught a new part, she had us go back to the beginning and do the whole thing over. She wrapped up the class by having us do it on someone else. She was very thoughtful of our time and did not waste it at all. Lynn made what could have been a very complicated system feel very simple. She and Keith, that's my husband, are organized with their communications with links and explanations of how to do technology. I highly recommend doing the class online. It was efficient, very easy to follow along, and with the camera access, Lynn was able to correct and connect with all participants. Excellent use of a Saturday. What else do you have to do on Saturday, right? June 13th, make a note. Now here's some other testimonials from the class. My daughter sprained her ankle early in a soccer tournament. We tapped out the fast aid technique once and she was able to resume play for the rest of the weekend. Do you know how devastating that is to those kids who are in those select soccer leagues? They get injured and can't play the other 5 games that weekend. Yeah, it's a big deal. And then for the parent to think I'm going to have to go to urgent care, and in this case here, avoided. I watched a calm come over my autistic son in seconds while the Cortices technique was performed on him. This is invaluable. Interesting. Isn't that great for autism? How about this one? What a miracle. I had a Charlie horse on my thigh for over 2 weeks from a tennis injury. I was getting ready to set an appointment with my doctor when my friend tapped out BodyTalk Access. It was better within a couple of hours. And I used to get some kind of cold or flu every season. Last year, I started tapping out the body chemistry technique each time I encountered someone that was already sick. That's very important for you to hear. I have not had a cold since. What a value and savings to not have to go to the doctor. So just a few testimonials from a course you've probably never heard of called BodyTalk Access. Highly recommend it. More information on the homepage of our website. So that live interactive webinar, June 13th, 9 to 5. I'm going to tell you, we're going to offer some special here. So I want you to hear this. That class, use it, you know, learn it once, use it for a lifetime. I kid you not. We're going to tell some great stories during that class. So the class is normally $175 to take it. We're offering a special right now for $150 for the entire 9 to 5 class, including all the other materials that you're going to get with it. The other thing I want you to know is that if you know or you are a medical frontline professional, we're going to offer the class to you for $99. So if you know a frontline medical professional and you care about them and their immune system and everything else, let them know. If you refer them, we're going to give you $25 in BodyTalk credit that you can apply either to their tuition or to your own. So you need to know that. And there's no limit. So if you invite 5 people who all sign up for the class, you're practically getting your class for almost free. So maybe invite, yeah, I think that's right, 5 people, 6 people. There you go. Something like that. I don't know. It's one of those. So next thing to know, why you should be drinking hydrogen water. That is our webinar next month. Live webinar, June 18th, 8 o'clock Central Time. Invite your friends. It doesn't hurt. They'll learn a lot of great information. Water is such a good thing to be drinking in the summertime. All the time, but especially in the summertime. All right, so that concludes our presentation. AccessCompleteWellness.com is our website. Our phone number, 972-712-0892. And the email address to reach us at, info@accesscompletewellness.com. info@accesscompletewellness.com. So if there's any questions, let us know. Reach out to us. We'll be happy to answer those for you. Again, thank you. We know you have an opportunity to be elsewhere at this time, but you chose to spend it with us. That means a lot to us. And that's why we're going to share many gifts and offerings with you when you get this playback. Please give us a few days to get that all together. It's a lot of material. It's a labor of love. We want to make sure you get everything you need. Thank you so much for being a part of this presentation.